Welcome to the mHealth Africa Summit. This is the first time we are holding a multi-stakeholder summit on the promise of mHealth for Africa. It's bringing together a large group of people from the IT and ICT field, people who work in finance, health professionals, economists, and a broad range of practitioners, including investors, who are looking at what we could do to get innovations that would push health solutions in Africa in a manner that would be efficient, effective, and sustainable. So why are we looking at mHealth today? Let me just share with you a few statistics. Every minute, a woman dies in childbirth in Africa. For every woman who doesn't die, there are 20 who suffer severe complications during childbirth, including having infectious diseases after childbirth. This figure represents about 10 million women on the continent who die needlessly or suffer needlessly because we haven't figured out how to make solutions available at the local and community level. According to the WHO, we still have an HIV problem because we've achieved a lot of success, but as of 2007, 2.5 million new cases got added to the count of people who are HIV positive on the continent. And on top of that, there are the infectious diseases that we need to counter, malaria, tuberculosis, and so on, which have implications in terms of how solutions get carried out country by country. mHealth provides an opportunity to configure new solutions that would address some of these problems. Let us start off with the problem of providing access to people, for example, women during childbirth. We know that right now the world is facing a crisis in terms of the shortage of nurses and doctors. It's estimated that there's a deficit of about 2.5 million health workers. And to bridge this gap worldwide, we need to think about new solutions for providing health. mHealth solutions allow, first of all, to bring the cost of providing health care down. It is estimated that using a variety of mobile solutions, the cost can be brought down to about 25% of what it costs to give health care using non-mobile means. This is a significant reduction because it could quadruple with the same budget the amount of people or the access that people have to health. The second area is not so much efficiency but effectiveness. Using mHealth solutions, one can find better ways to collect data, whether you are doing clinical trials and you want to observe in real time what the reaction is to particular treatments, or whether you want to make a quick decision in terms of aggregating treatments for communicable diseases. So the effectiveness of data collection, particularly in terms of distributed data collection, is a key area where mHealth can provide cost-effective solutions. The other area has to do with sharing ideas and connecting all the people in the supply chain for health services, whether it's the nurses, the doctors, the statisticians, the pharmaceutical industry, and of course the patient. By being able to connect all these different elements of the supply chain, one can uncover ideas of efficiency, ideas of new ways of treating, new ways of aggregating data, management information systems that support health, and a whole slew of innovations that are possible when you are actually linking up people in the entire supply chain. The power of mHealth also represents, beyond cost effectiveness and efficiency, it represents an opportunity to widen access. Because particularly in rural areas, in small communities, or in areas where it's too costly to have regular clinics and regular treatment centers, mHealth provides an opportunity where you can connect people who are semi-health educated, meaning they know the basics of what to do in terms of treatment, with the professionals at the nursing and the doctor level who can then provide advice and solutions for more complicated treatments. So the fact that it can aggregate skill levels at the local level in a centralized way that brings in the right skills when they're needed at the right time is an opportunity to stretch the resources that are quite meager in terms of healthcare professionals. In order to guarantee sustainability and cost effectiveness, there are a number of investments that are also needed. The first category of investments is infrastructure. Of course, every time there is a mobile solution, it also generates a trip. So the important role of roads and logistic transportation, whether it's to transport pharmaceuticals or to transport healthcare workers once the mHealth solutions have been brought to a point where you need actual treatment. So there is a link between mobile health and investments in infrastructure such as roads and of course the backbone for an ICT and telecommunication system. There is another area of investment which is really the soft side of the infrastructure, the social infrastructure, because health interacts very strongly with culture. And when you introduce technology into culture, an existing culture, there are adjustments. And the interface between culture, telecommunications, technology, and health would be a whole rich area that needs to be looked into, so that some of the issues that could be limiting in terms of providing solutions could be known in advance, and customized solutions that use technology in a way that doesn't introduce difficult elements in terms of choices, particularly when you talk about women and girls. That would be a very useful area to look into. So again, sustainability, effectiveness, investment in infrastructure, and investment in the social side, the social change and the transformation part which interacts with culture would be very important. And it's my hope that in the audience that has been invited to this conference, that they are also sociologists and people who work at the community level, who have experience in attracting solutions from local and community organizations, who can share their experiences, as well as the financiers, the engineers, the entrepreneurs, and the health workers. There are a number of examples and case studies that have done. Some of the more familiar ones are, for example, text to change, where you use your mobile phone to text and get solutions for health simply through SMSs. And there are others like Project Masiluleke, which is also experimented in different solutions for using mobile treatment and mobile advisory services on the continent. The key question is, how do we make these types of success stories at the case study level or the pilot level sustainable? What does it take for sustainability? Well, first of all, it takes finance. And the financial professionals who are here, we hope you'll have an opportunity to interact with the other stakeholders to come up with innovative ways of financing mHealth solutions. The second area where there is need to look into to come up with sustainable solutions is the particular entrepreneurial, innovative starting point. You give somebody a technology and they uncover a new way of using it, such as we've seen, for instance, in M-banking, like the M-Pesa program that is being used by Safaricom in Kenya. So we do know that a new technology like mobile phones can be used to come up with innovations, and entrepreneurs, when they're unleashed with a new technology, can innovate and create around that. So that's another opportunity for you who are entrepreneurs in the audience to interact with other stakeholders, find the financing that you need, and also share your ideas with healthcare professionals. And for the healthcare professionals, this is an opportunity to share the difficult issues, the challenges that are being faced in providing healthcare solutions, so that the entrepreneurs and innovators, along with the financiers, can work together with the healthcare professionals to come up with win-win solutions that are bankable, that are sustainable, that are implementable, and that have impact. It is my hope that at this conference, because of the specific target that has been made in bringing an audience of multiple stakeholders who are all involved in different components of the healthcare supply chain, putting them in the same room and same environment with financiers, entrepreneurs, policymakers, and of course citizens, that ideas will come up from this conference, so that it's not just a place where people come to talk, but it's a real networking opportunity, a real exchange where ideas can be taken from talking to doing and to results. What do we expect from this conference? The main expectation is that the conference will generate networks of collaborators, networks of change agents, and together these networks will find a way to put in place solutions that, if we come again next year, we'll be talking about concrete outcomes that have come as a result of this first mHealth Summit in Africa. So I'd like once again to say welcome to the mHealth Conference. We hope that your participation here will lead to ideas that can be taken up and maybe by the people who are already there, but also by others who are involved in the different elements of supplying healthcare solutions. If I may say a few words about my organization, I head the African Capacity Building Foundation, and we look constantly for innovations in capacity development and the difficulty of attaining the Millennium Development Goals in the 5 years that remain until 2015 is an area for particular challenge and an area that we are looking for solutions. So we hope to harvest also and perhaps even support some of the ideas that may come out from this conference. So thank you very much for your attention, and I wish you all a wonderful opportunity at this very first mHealthcare conference in Africa.